Hello, everyone. This is Dr. Ivy. Welcome to my YouTube channel. And today I'll be discussing on computer vision syndrome amongst digital device users in Nigeria. So a lot of people might ask, what is computer vision syndrome? I'll simply start by saying computer vision is a collection or pattern of symptoms associated with prolonged exposure to digital devices. Now, there are a lot of complications as a result of using, or let's say symptoms as a result of using the computer or any digital device for a prolonged period of time. And now, over the years, I've been practicing. A lot of patients coming with a lot of symptoms, and they don't even know that the symptoms they have are actually associated with their prolonged use of computers and their devices. So one of them is headaches. Now, a lot of patients come in and say, "Doctor, I have headaches, I have headache, I have headache." Dry eye, my eyes tend to feel dry, itching, burning sensation, itching, twitching of the eye, redness, a whole lot of symptoms. And what do I do at this point in time? I try to probe further and ask, okay, what kind of job do you do? And when they say the kind of job they do, how long do you spend on your phone in a day? I just try to probe and ask the patient some questions to actually know what must have triggered these symptoms they have. Then, so far so good. So when we are done, find out that because of their prolonged use of these devices, they come up with all these symptoms. Now, there's a management pattern or method we use to actually reduce these complaints by patients. So one of them is by use of computer glasses. As you can see, I'm wearing one. There's a blue cut filtered lens. It's a blue filter lens actually. It's actually used for computer users, any digital devices at all. Then we also advise you use artificial teardrops to try to lubricate the eyes as often as you can, because you notice that when you use your phone, your computer, your laptop, your tablet, you notice that you tend to blink less and thereby causing the eyes to become dry. Then we also advise that you try to look away from the computer after every 20 minutes of staring at the computer. So you try to look away and try to also blink as often as you can while using your computer devices. Now that brings me to the blue filter lens. So a lot of people are not even aware of what the blue filter lens does and what it is all about. Sometimes when clients come in and you tell them, "Okay, madam, you benefit more from a blue filter lens," and they keep asking what a blue filter lens is. Okay, actually the blue filter lens is actually a lens that has been made or manufactured to block harmful blue lights that get into the eyes. Now you might say, where do we get this harmful blue light? Like I said, when you're exposed to your phones and other digital devices, the blue light actually emits from these devices. And eye care practitioners have been concerned lately because of the exposure of a lot of people, children, parents, a lot of people, to these digital devices and their effects they will have long term on the eyes. So we usually advise you go for a blue cut lens, which tends to block out the blue light. It tends to relieve all the symptoms you experience, such as sleeplessness among some people when they use it at night. So what the blue light does is that during sleep time, if you use your phone before bedtime, you notice that it actually affects the sleep hormone or disrupts the sleep hormone, thereby causing sleeplessness. So when you use your computer lenses at night, before whatever you want to do at night before you go to bed, you notice that you tend to sleep better, and it tends to protect from the effect of these blue lights. Studies have also shown that prolonged exposure to these blue lights can actually cause what we call a macular degeneration. A macula is actually the seat of vision that actually helps in giving us the clearest of vision. So prolonged exposure to this can actually cause a degeneration in that area, and thereby leading to further issues. So I would advise that you try to see your eye care practitioner at least once every 6 months. And you also ask, okay, what of those with myopia, hyperopia, can they also get the computer lens? Yes, you can. Your prescription can actually be incorporated in it. And if after you've done your glasses test and you have no refractive error, you can still go ahead to have your computer glasses. So if you've learned one or two things from this channel, please kindly click the subscribe button below and try to follow this channel for your eye care updates. Thank you.